I have been looking at using sympathetic blocks with stellar ganglion blocks since my first paper came out in 2008. So today we're presenting something new, actually. I have had absolute honor to take care of a lot of special operator force people, such as Delta Force people, Green Berets, SEALs, and people such as that. What I found about them is a lot of them have TBI, specifically blessed TBI or BTBI. The reason I found out about it is I was doing a Green Beret experience for a weekend, and we did some breaching, which is taking down some doors using pretty light breaching technique, and my head was buzzing. So I asked the guys, is that what happens? Oh, you're a wuss. We use C4 to take down walls. You just took a little piece of a door down. So that actually led me to believe or look into finding out what's going on. Turns out there's quite a bit of literature about that. So since we've been doing a lot of military personnel doing stellar ganglion blocks, the new version that our clinic has been doing, I'm now a chief medical officer for Stella Center, and we're at a number of sites. So we're doing quite a large number of those type of procedures. So typically, the original publication of 2008 was right-sided stellate ganglion block at C6 level, which is technically not stellate, but close. So we're currently doing a dual procedure, which is C6 and C4, which we call dual sympathetic reset, but for the sophisticated audience, it's multiple circle sympathetic blocks. And those who are interested in why, we can discuss that later. Anyway, so that seems to work quite well for PTSD and PTSD-like disorders. However, for TBI, it does seem to help, but not enough. So we have been doing a technique that I'm trying to call SOF method, Special Operative Force method. And we are combining ketamine as well as DSR, which term we like to use. So basically, we use standard subanesthetic dose of ketamine for depression and things like that is 0.5 milligrams per kilo. We do this Monday, Tuesday, Wednesday. Then we do a right-sided dual sympathetic reset on Thursday, and on Friday we do another dual sympathetic reset on the other side, and we do a ketamine infusion. So if I had the slides, I'd show you the numbers, but the PCL score, PCL5, which is standard assessment tool for PTSD, has marked drops. Just to give you a feel for it, in most studies, psychiatric studies, 10-unit drop is considered significant. Our average drop is about 25 to 28 units, which translates into significant change in life and function, as well as sleep. So what we have seen is self-report. At this point, we haven't really had a great TBI or traumatic brain injury assessment, but people telling us that memory is coming back better, they can sleep better, they're less depressed, the cognitive function is improving. Where what we're finding is that there seems to be a synergy between ketamine and sympathetic blockade. So I spent a decent amount of time trying to figure this out. So this cohort that we're presenting on today is 5 patients, more than 6 months out. There seems to be decent longevity. But one of the parts that I was very interested in is the mechanistic. There seems to be synergy, as I've said. So ketamine does a few things. It promotes nerve growth. It activates neurogenesis. One of the most sensitive nerves in the brain to neurogenesis is sympathetic nerve, which is a very bad thing for people with PTSD because that eventually increases norepinephrine and more symptoms. It also activates something called BAX gene, which, frankly, I never heard of it until I looked into it in detail. And that's from cancer literature. So BAX gene activation reduces function of hippocampus, thus suppressing memory. Stellate ganglion block or sympathetic blocks seem to reverse BAX effect on the brain. There's at least one paper on that. So those who are interested, I'll be happy to provide those for you. But it also prunes sympathetic fibers. So if you can reduce sympathetic fibers, the bad effect of ketamine, so to speak, is reduced. Thus, I believe there is a synergy between the two. But clinically, the results have been pretty amazing. And if you think about the special forces goes through a year of training, and they have 100 to 200 TBI events in training. We're not even talking about active duty. So those guys really need all the help we can give them. And it's been very interesting to see how they have improved. I think in the next meeting, hopefully, I'll be able to present a much bigger cohort. We've treated currently 120 people with that SOF method. Hopefully we'll have the data at that time. Without slides, I'm sure there's nothing else I can share, but I can certainly answer questions if people are interested.